Good morning, everyone. The topic for today's presentation is role of participatory women group-based intervention in improving health and nutrition behavior of lactating mothers in Eastern India, evidence from Swabhimaan program. Uh, Swabhimaan program basically evaluates the delivery of a package of 18 essential nutrition uh, intervention via Ajivika promoted village organizations to improve the nutritional status of girls and women in three Indian states, namely Bihar, Chhattisgarh, and Odisha. The target group intervention are delivered through system-based and village organization-led approaches grouped under four pillars such as system strengthening, Neo-led intervention for adolescents, women, and village resource persons. Women's self-help groups remain an untapped platform for improving reach and use of essential nutrition intervention. The objective of this paper is basically to assess effect of engaging with community resource persons and groups on access to health and nutrition services and related behavior of beneficiaries in the intervention areas. The study is basically based on the midline data collected from these three states. The data was collected during the period September 2018 to June 2019. Previously, in 2016, a baseline survey was carried out. The the approaches are it's a comprehensive package of 18 nutrition specific and nutrition sensitive delivered through community led actions by VO and CLF, facilitated by trained female CRPs. Intervention and control receives system led interventions such as integrated health, nutrition, agriculture, and livelihood services. Intervention areas additionally receive community led actions delivered by a female community resource person called Poshan Sakhi. Uh, the studies a cross-sectional survey and the sampling design is basically multi-stage stratified cluster sampling. In the first stage, the sample was selected. First stage, villages were selected using probability proportional to size sampling. Once the villages were selected, then complete mapping listing was done to identify the target group population. Once this was done, then the required samples, that is around 500 from both intervention as well as control areas, were selected based on using a systematic random sampling method. Now, coming to the various intervention packages. So, first one is to improve food and nutrition intake. Under this, there are various access to household rations, access to supplementary nutrition, take home home cooked meals, access to knowledge about how to improve diet diversity through education, nutrition sensitive and pesticide free agriculture, access to food in case of food insecure periods are there. Second one is like prevent micronutrient deficiencies and anemia. This includes iron and supplementation of iron, folic acid tablet, calcium and deworming tablets, universal use of adequately iodized salt, access to information to prevent malaria and fluorosis. And another part is to increase the access to VHSMD services and special care to at nutrition risk. So here, this includes early registration in outreach health services, recording and monitoring of nutritional status, quality reproductive health, antenatal and postnatal care, promotion of institutional delivery, access to information about tobacco and alcohol use in pregnancy. And wash practices are included, which includes sanitation and hygiene practices and access to safe drinking water, and also prevent early, poorly spaced or unwanted pregnancies. This includes delay age at first pregnancy, prevention of repeated pregnancy, and includes spacing. So now I will discuss the role of this female community resource person. They are called Poshan Sakhis in these areas. So what is the role of Poshan Sakhi? Basically, they facilitate the development of integrated nutrition, microplan at bio level. They develop an annual plan of activities and a budget to address the problems. They organize monthly women's meeting, group meetings. It is called IFPRI-POSHAN for women to facilitate participatory learning, and linking women to agri poultry or nutri-based livelihoods and ongoing entitlement services like VHS and the ICDS, AWC, and PDS. Further, they are involved in screening nutritionally at-risk beneficiaries, providing monthly home visit, food demonstration, counseling to nutritionally at-risk women. And also they set up backyard, they help to set up backyard nutrition gardens and poultry in their homes with support from VO. So coming to the main findings, so this graph shows the effect of engaging CRP and groups on access to health and nutrition services. So we can clearly see the like variation, significant variation in some of the variables. For instance, if you see the consumption of Tiranga Bhojan, in all the three states, there is a significant variation among participants as well as non-participants. For example, in Bihar, 86% consume Tiranga Bhojan. 86% of participants who consume Tiranga Bhojan, but the corresponding percentage for non-participants are 12 only. In other two states, Chhattisgarh and Odisha, also there is significant variation. However, more variation was in Bihar. Again, homestead nutrition garden, if you take, it is considerably more among participants. Consumption of IFA, although there is not much variation, but it is comparatively higher among participants only. And another significant variation was found in attending the VHSND meeting. Here, if you see participants, more participants attend VHSND meeting as compared to non-participants. If you consider other variables like live-in household with a toilet, again there is a variation. Pool data, it is not there, but state-wise, if we take, we'll find some variation. Institutional delivery, it was like almost equal percentage. It was like almost same, not much variation was found. But when we talk about ANC utilization in first trimester, there was some considerable variation among participants. Again, use of modern family planning method, if you see, the percentage is higher among participants. But when we consider all these variables, the significant variation was found in the case of Tiranga Bhojan as well as participation in VHSND. So coming to the conclusion and policy implications, interventions delivered through female community resource person can improve health and nutrition related behavior like consumption of Tiranga Bhojan, participation in VHSND, ANC utilization in first trimester. But there is a need to promote women's participation in such interventions to ensure maximum benefits. Since Swabhimaan layers the essential nutrition intervention onto the ongoing livelihood program of the government, these findings highlight that bolstering women's involvement and participation in ongoing Poshan Abhiyan could prove a milestone in combating malnutrition. With regard to the adaptation during COVID-19, the midline survey was completed before the outbreak of COVID-19. But due to this pandemic programs, intervention activities were selectively halted. The female community resource person, that is Poshan Sakhis, were actively involved in COVID-19 awareness generation and delivery of essential goods and services to the community. Thank you.